Добрий день всім, хто до нас тільки що доєднався. Нагадую, що ми з вами
Good afternoon, everyone who's joined in this afternoon. So we are sharing a big online event dedicated to catabolistic children management in the PMG framework. Well, here now, so we have the courtesy of Arunas Liubsys, who is the president of Neonatology Association, and he's in charge of hospital department in Vilnius, Lithuania, and myself, Kateryna Bulavinova, who is a medical expert of UNICEF here in Ukraine. So first of all, Arunas would like to thank Lithuania for the unfailing support that she shares for Ukraine. For us, it is very important. That is why, so can you make a start, please? And we will have a short time left for questions and answers then, Arunas.
Good afternoon, dear colleagues. The best regards from Lithuania, actually, and I will try to share with my screen now, and will try to introduce shortly.
We can see now your...
Arunas, can you speak closer to the microphone?
Yes, do you hear me?
Yes, I can hear you, but closer to the microphone, please.
Yeah, I'm trying to do that. I'm trying to do my best.
Yes, they are as
well. Is it okay now?
Not yet, just a sec. Okay, you start, and we will do some magic here so that we can see both you and the presentation. Presentation is seen very well, and we can hear you very well, so you go ahead.
Okay, thank you very much. So I would like to introduce you shortly our experience in Lithuania, how we developed the follow-up system for the newborn babies here. And at the beginning, I would like to start with some main steps in reorganization of perinatal neonatal care in Lithuania, because everything is related. All together, all our steps are related with each and other. I think that since our independence, declaration of our independence, 1990, the first very important step was establishment of perinatal committee at Ministry of Health, which actually, with participation of main obstetricians and neonatologists who actually started to work out the perinatal program. In 1991, the next very important step was introduction of new life definition according to WHO recommendations from 500 grams and 22 weeks of gestational age. And so that our statistics came closer, or came very close to what people are presenting in the rest of the world. And since 1992, we started regionalization of perinatal care and introducing the new neonatal transport system and other steps. And actually, since 1997 to 2007, the Ministry of Health announced of National Program of Maternal and Infant Health. And since that time, we are gradually developing and introducing of the standards of perinatal neonatal care, national guidelines, protocols, introducing the quality control and quality assurance system in our country. And the main components of reorganization was establishment of three-tiered medical care system for women and the newborn, with the standards of medical equipment and medical services based on level of care provided. And of course, it was parallelly the introduction of new financial system based on level of care provided was also started, and also some other components like continuous education of medical staff, introducing of consultant transport system for pregnant women and newborn babies, and so on. And what is important, that three-tiered system of perinatal care, sorting out the hospitals according to the level of obstetric neonatal care provided, setting up the standards for each particular level of care, and it's also very closely related with accreditation of the hospitals. Diagnostic or treatment standards or clinical protocols for each particular level and obstetrical care were developed. And it's like a schematic that we have a few district hospitals providing the basic care for pregnant women and the newborn baby, regional hospitals and biggest maternity hospitals in Vilnius and Kaunas, and two university clinics, or they're acting as two perinatal centers, and they both are affiliated to the teaching universities in Vilnius and Kaunas. And according to our perinatal care, Vilnius and Kaunas perinatal centers are responsible for for eastern and western part of Lithuania, and you can see that clearly in this map that how we are sharing the territory of Lithuania, and as well sharing the patients, high-risk pregnant women, and the high-risk newborn babies. As a part of all changes, development of neonatal infant follow-up system was started to be introduced since at the beginning by the end of 90s. And the first two departments of newborn follow-up were opened in two prenatal centers in Vilnius and Kaunas. And since that time, the gradual development of multidisciplinary follow-up teams consisting from neonatologists, pediatric neurologists, pediatric cardiologists, medical psychologists, social pediatricians, speech therapists, occupational therapists, and others started to become members of these multidisciplinary teams. And of course, we cannot imagine the development of follow-up system without close cooperation with Child Development Center and also our Physical Rehabilitation Center. And of course, we are trying now to develop long-term follow-up up to adolescent and referral to adult specialists, those kids who had problems in the newborn period. Interestingly, that we came to the conclusion that the developmental care should start at the hospital level, since the baby is hospitalized with the mother. And of course, diagnostic and treatment program for the high-risk newborns, including those born prematurely, and their families during their stay in the hospital. The program is individually tailored to each newborn and focuses on supporting and development of the newborn baby, adapting the environment and using care strategies, applying the principles of the family-friendly hospital and developmentally supportive care, and integrating them into traditional model of medical care. In September 2015, multidisciplinary newborn development care team was established and started activities at Neonatology Center of Vilnius University Hospital. And you can see three nice ladies that represent social pediatrician, medical psychologist, and occupational therapist, who are actually doing a great job since that time, already almost 10 years. And the objectives of this multidisciplinary developmental care team was to create a physical and physiological environment that minimizes the impact of the hospital environment on the newborn and his or her family, recognize the signs of disorganizational and self-regulation displayed by the neonate, and act to support the neonatal efforts to achieve and maintain autonomic motor stability. Increased parental involvement in the planning and implementation of care strategies for their newborns. To support parents' efforts to acquire competence of caring for their newborn, and to encourage parents' efforts to integrate their newborn into the family. To share with the parents information about the services, offering early childhood developmental programs, their immediate environment. And as I mentioned, this team consists of 3 specialists, starting from the social pediatrician, who coordinates the work of the team, assesses the newborn's development, his and her family needs, draws up developmental care plans, monitors their progress, provides recommendation to the family on the child's education and further rehabilitation in the community. Occupational therapist applies the individualized model of care and assessment of the newborn's development and family-centered practice, supporting motor development, supporting sensory development, supporting the development of eating skills, building self-regulation skills, training of parents. And medical psychologist assesses the psychological state and needs of the family, provides the family with the psychological support and emotional support to reduce the stress while they are staying in the hospital, educates parents by providing them with relevant knowledge and skills, monitoring the mental health status of the family members, as recommending referral to mental health professionals if necessary, provides information on further psychological support options. And actually, these activities of this multidisciplinary newborn developmental team really made our life really different, especially for us neonatologists. And they're taking out of us a number of activities, actually, they being a part of the whole management process of the preterm babies. And as a result of the work of this team, and afterwards, another thing what is important that this team already, for the babies who are staying in the hospital, they are trying to define the problems that these babies could face in the future. And also this is kind of, they are providing the first screening and also the first help for the families as well as for the baby already being in the hospital, and also helping very much for us to plan the discharge of these babies from the hospital, and also also the planning for the first and the next visits after these babies are discharged from the hospital. And as a result, we developed screening and monitoring for newborn health and early developmental disorders, kind of the program and the protocol, which is our specialists are following and taking care of these babies after they are discharged from the hospital. The program focuses on the screening, developmental monitoring, clinical assessment, and follow-up of the newborn babies born prematurely before 30 weeks and 6 days, or an increased risk for development and medical disorders after discharge from the hospital. Monitoring newborns at increased risk of developmental disorders helps to identify babies with developmental disorders earlier and to start early interventions and rehabilitation. I just put it there, the inclusion criteria. I will not stop on them in more details, but these criteria are quite clearly defined and are strictly followed regarding the babies who are born prematurely, and there are the diagnosis based on 10th International Classification of Diseases, as you see here and here. As well, there are a number of term babies who are also falling in this inclusion criteria, and they are also followed up by our specialists after being discharged from the hospital. The neonatologist on discharge from the hospital selects neonates according to the risk of the developmental and medical disorders, and the neonates for outpatient neonatal follow-up in neonatal center already. Physical assessment of selected infants is performed by neonatologist at neonatology center between 2 weeks and 1 month after discharge to home from the hospital. During the first visit, neonatologist at neonatology center makes a plan for further developmental follow-up of the premature newborn baby in the neonatology center, or the premature baby is referred to the child development center for developmental follow-up. Elective neurosonography is performed at 1-2 months after discharge and inpatient care, or as recommended by pediatric neurologist. Scheduled outpatient ophthalmology consultation on the recommendations are under recommendations of the ophthalmologist, and scheduled consultation with pediatric otolaryngologist, audiologist is at 6 months of age. And the following visits are scheduled and depending on the baby's condition, and either they are done in neonatology center, and these babies are followed by or examined or followed by neonatologists, or at the early rehabilitation unit of the child developmental center, which also belong to our university hospital. And here is kind of flow chart of how the babies, these high-risk newborn babies are followed up, and you can see that the scheduled consultations in neonatology center after the first is done in 2 weeks or 1 month after discharge, and then it was all, as it was already mentioned, in different ages. And neonatologist is following the baby up to 2 years old. If the normal condition is, if the baby is in normal condition, then of course the number of visits could be diminished up to 1, 2, or maximum 3 per year. But if the baby is at risk of development disorders, then different steps should be or could be taken also. And here you can see another way how these outpatient consultations in neonatal center are scheduled, and you see that these babies are followed by pediatric neurologist, pediatric ophthalmologist, and cardiologist. And later on, as I said, the number of scheduled outpatient consultations depending on the decision of the baby's condition, and also on the decision of neonatologist. I just wanted to tell you a few words about the special project for preemie families. The project took place at Vilnius University Hospital in 2018-2023. It was called Prevention of Mental and Developmental Disorders in Children and Adolescents and Family Support. And this project was financed by European Social Fund. And part of this project was the program. One part of this project was promoting the development of premature newborns and infants and supporting their family. And this was implemented from the early rehabilitation unit in the Child Development Center. The main aim of the program was to provide psycho-emotional support to parents and to teach them to know their child, his or her special needs, developmental peculiarities, and care methods for the babies. Families with the babies born prematurely and already discharged from the Vilnius University Hospital Neonatal Clinic, 3-4 months to 1 year of corrected age, were invited to take part in this program. The family sessions were held for 1 month, 1 meeting per week, for total 4 sessions, led by a doctor, a psychologist, an occupational therapist, physiotherapist, and music therapist. 2 different specialists were involved per session. The sessions were organized in groups, typically 4 families per group, with the babies of the same adjusted age. And this kind of example, what they were, how were they, carried during this project. And during the first meeting that was led by the psychologist and neonatologist, the families were introduced to the challenges of parenting of premature baby, developmental self-regulation, and of premature babies in the first year, supporting for them. During the second meeting, which was led by occupational therapists and physiotherapists, understanding and development of sensory development of the premature infant, premature baby's motor development, assessment and support. And as you see in the meeting 3, that was led by occupational therapists and music therapists, premature infant feeding peculiarities, oral or whole body sensor motor peculiarities, the role on music sounds and music rhythms in the development of the preterm baby, and so on. So this project was very successful and very well accepted by the families. And as it was mentioned, it was quite not a big groups, just 4 families per session, per meeting. That was really good way to communicate with the specialists as well. The families could communicate between themselves. And this project was, as I mentioned, was very successful, but unfortunately, it's not does not have the financial support anymore. And while we are looking forward to reintroduce this project again and to continue work with the families. And I think this is one of the interesting way how to support the families that have the preterm baby or the baby at risk of the developmental disorders. On the basis of this program, the methodological guidelines, care and long-term follow-up of the preterm babies has been published, dedicated for the healthcare specialists, social workers, teachers, and etc., and aimed to support all those who are taking care of the preterm babies and their families. The guidelines provide detailed information on the diseases and conditions of premature newborns that affect their future development, their developmental characteristics, and the procedures for monitoring their development in the first year of life. And summarizing, I would say that with the advancement in the neonatal intensive care units and introduction of new technologies, the number of surviving extremely low birth weight babies increasing, and the potential of having children with long-term disabilities is on the rise, unfortunately. Neonatal follow-up programs are the best tool available for proper neurodevelopmental evaluation and follow-up of the high-risk infants who are increasing in numbers. Close collaboration between neonatologists and other specialists and with their families, the families of the high-risk newborns, and the establishment of clear system for long-term follow-up can help not only to detect developmental disorders in early stage, but also to undertake early rehabilitative intervention, as well as improving the quality of life of these patients. Thank you for your attention.
Arunas, ми вам дуже дякуємо за цю презентацію. І в нас є питання, наприклад.
Arunas, thank you very much for this presentation. And for instance, we have the question from Ina. So from what age? So when do you do immunization of these children, and where exactly, please?
We are starting to immunize the babies already at the maternity hospital, actually. And then they are coming during these visits, especially those babies who are at risk, they are coming on the special, they're involved in the special schedule of immunization, especially for the RSV infection. And before the virus infection seasons, we are trying to immunize them, and they are falling into the special program, national program of the immunization. And if the baby, the preterm baby is missing immunization, for example, for tuberculosis, they could be done, this could be done during one of the visits later on.
I've got a follow-up question to ask you again. So which problems did you occur throughout the time when you tried to introduce this catamnestic monitoring system in place? For instance, did you come across a resilience of the health professionals and from parents, and where and exactly did you experience a lack of professions, so someone was not willing to come around? And so what were the system problems when managing such children?
Yeah, as you mentioned already, the one of the problems is that that it's not always easy to get the families come back with these children to be followed up. Fortunately, I think that we have around during the last years we have success rate of being followed up to 80-85% of all of our patients who underwent treatment in our neonatal clinic. But we also accepting those babies who are coming from another places, like from another hospitals, because the kind of multidisciplinary team is just available in our university hospital, and also in Child Developmental Center. They have all kind of specialists, and that's very very useful, and I would say it's necessary to have the multidisciplinary team, that in case if the baby has some developmental problems, that that baby could be directed to particular specialist who is like a speech specialist, like a pediatric neurologist and psychologist and so on. So in case if we are really finding something what is not really correspond to the norm of the baby, then we are trying to involve as many specialists as possible. And also our university hospital has a big rehabilitation department. Actually, this is not just for the newborn babies or the infants, but also for the older children. But they are taking care of our patients starting from 3-4 months of age, of corrected age, if these babies need to be, need any kind of rehabilitation as well. That's what I mentioned, that it's really important that not just neonatologists, but the system, it means that the multidisciplinary team would be involved in this follow-up process.